Hello, ladies. Shalom, sisters. Today, we're going to have a brief talk on fibrocystic and related breast conditions. And again, I am referring to the book Herbal Healing for Women by Rosemary Gladstar. So, breast tissue is composed of fat and milk-producing glands that are controlled by a monthly cycle of changing estrogen, progesterone, and prolactin levels. During the month, hormonal changes often cause the milk glands to swell and retain fluid. Small cysts may form and are especially prevalent in the lymph nodes under the armpit. Fibrocystic lumps feel like small balloons filled with fluid and seem to float when pressed. They've often been compared to feeling like an eyeball under a closed eyelid. The swollen enlarged tissue is often painful. When menstruation begins, hormonal stimulation ceases and the breasts return to normal. Not a disease, but a condition. Fibrocystic breast lumps are benign breast tissue. They are as normal in some women as menstruation, pregnancy, and menopause. They are a typical characteristic of the hormonal changes we experience each month. It's common, not uncommon, for women to experience them. They're generally easy to detect because they change with our monthly cycles, usually becoming more painful and inflamed a few days before menstruation begins and disappearing shortly after menstruation is over. Though neither cancerous nor malignant, fibrocystic breast tissue is painful and worrisome to many women. It makes detecting cancerous lumps more difficult. It can be a signal that our hormones are out of balance. Too much free circulating estrogen in the system causes the tissue to swell and hold water. A deficiency of essential fatty acids, or EFA, is also indicated. Essential fatty acids are needed to regulate prolactin and prostaglandins in the system. This cyclic condition can be regulated by diet and herbs. It's also important for women to take a serious look at their breasts and how they feel about them. A symbol of nourishment, breasts are often misrepresented as sexual objects. Our culture, so lacking in self-nourishment and love, has become totally preoccupied with the size and shape of breasts and out of touch with the marvelous nurturing energy that they represent. So our challenge comes in learning to distinguish normal breast changes from abnormal growths that can indicate cancer. Unfortunately, we are not taught to recognize these normal changes. We live with a fear that every change in our breast tissue is a symptom of cancer. However, it's not the scope nor purpose of this talk to distinguish between the different types of breast tissue, nor how to distinguish benign growths from potentially cancerous ones. So I'm going to recommend a book. It's called The New Our Bodies, Ourselves by Boston Women's Health Collective. You can probably find it on Thrift Books or on Amazon. Now, following, as I always do, I will be including several programs, several recipes. One is immune cleansers, and also external treatments of fibrocystic breasts. The use of poultices directly to the mass helps. So there's an internal and external cleanse. And there's also a section here on, and I will read this. This is when you know that you have been diagnosed with breast cancer. If you have breast cancer, you may wish to try some of the herbal and nutritional remedies recommended here, in addition to, not in place of, your allopathic orthodox treatment. that is completely up to you. I'm saying this myself. I'm not reading this from the book, but that is completely up to you. I know of women who have chosen both, but to do the allopathic as well as the naturopathic route. But that is something that you're going to have to pray on for yourselves if you do find yourself in that situation. So I would suggest that the dietary suggestions that I will be sending to you and the poultices, and also the following. And I will also be doing a screenshot of this as well. So there's a chaparral tincture, 1 teaspoon 3 times a day. Chaparral tablets, 2 tablets 3 times a day. Chlorophyll and or wheatgrass juice, 1 teaspoon 3 times a day. Blue-green algae, 1 teaspoon 3 times a day. Pau d'Arco echinacea tea, 1 cup 3 times a day. Reishi mushroom, 3 capsules 3 times a day. Our next section will be on uterine fibroids, ovarian cysts, cervical dysplasia, and hysterectomies.